In the complete hemodialysis series, today we are going to see respect to a clinical situation when to prefer heparin-free dialysis or when to avoid heparin dialysis or any anticoagulation for that matter. Just we are going to see the situations when to avoid. It can be divided as absolute contraindication and a relative contraindication. Absolute means don't give at all. Relative means depends on the patient clinical situation. Yes, it can be given or not. Depends on the risk and the benefits. First, any active bleeding, if the patient is having, don't give heparin. Any active bleeding for that matter, which is significant, a upper GI bleed, a lower GI bleed, significant epistaxis, or any kind of intracranial bleed which is current, for which patient is admitted. So don't give heparin. Second, uremic pericarditis, don't give heparin. Uremic pericarditis, from the clinical team, the technologist will get the instruction, don't give heparin, because uremic pericarditis might change into hemorrhagic pericarditis. Whenever there is any surgery, immediately post surgery, if the patient requires dialysis, during that time don't give heparin or select heparin-free dialysis. Post kidney biopsy, within 1 day, even if the patient requires dialysis, don't give any heparin. Not only biopsy, any intervention for that matter, if it occurred within 24 hours, better not to give. When the patient is having very low platelet, that is less than 50,000 in the CBC, if there is less than 1 lakh, but if you consider patient is at high risk of bleeding, don't give. In chronic liver disease, they are prone for coagulopathy, they are prone for bleeding, so it is a relative contraindication of heparin, don't give. And uncontrolled hypertension, if you feel patient is having high risk of bleeding, either past history of cerebrovascular accident which include a bleed, better not to give heparin. So these are all the situation where you have to avoid heparin. And again, this is a theoretical discussion. Absolute, yes, you can follow, but many other patient parameters have to be taken into consideration, because heparin-free dialysis associated with its own drawback of less clearance. So you have take that into consideration and adjust the prescription accordingly. So the conditions I have told, always think of heparin-free. Bye bye.